Hello, everyone. Thank you for joining today's educational webinar with Cancer Support Community Los Angeles. I'm Abby Espinoza, the Program Coordinator at CSCLA, and I'm honored to welcome you to this week's webinar titled, Frankly Speaking About Cancer, Breast Cancer and Gastrointestinal Side Effects. Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer, including patients, caregivers, and their loved ones, all at no cost. Our programs include support groups, healthy lifestyle classes, social activities, and educational programs such as this one. If you would like to learn more about our services or watch past webinars, please visit our website at cancersupportla.org. Before I introduce today's speaker, please note that your video and microphone are automatically disabled for this webinar. You may, however, enter your questions into the Q&A feature found at the bottom of the Zoom window at any time. Questions will be answered at the end of the presentation. We may not be able to get to all of your questions today, but we'll get to as many as possible. And to introduce today's speaker, Ashley Salazar is a registered dietitian nutritionist who has experience in both inpatient and outpatient nutrition clinical care. She graduated magna cum laude from Pepperdine University with the Bachelor of Science in Nutrition and Dietetics, and is a member of the Academy of Nutrition and Dietetics. She is bilingual in English and Spanish. Her mission is to reshape eating habits and empower patients to optimize their long-term health in sustainable ways. When she is not seeing patients, you can find her shooting cooking videos at home, trying new restaurants in Los Angeles, and hanging out with her cats, Santorini and Mabel. It gives me great pleasure to welcome today's speaker, Ashley Salazar.
Hi, everyone. Thank you guys for attending and being part of this webinar. I'm going to get my slides up. So today we'll be talking about breast cancer and gastrointestinal side effects that can happen from treatment. So again, my name is Ashley. I am a registered dietitian. I work at Providence St. John's Health Center. I do both inpatient and outpatient care for all patient and disease states, but primarily oncology. I have my contact information, email, and feel free to follow our Instagram from St. John's Dietitians. I have no financial disclosures. And just a little bit about CSCLA. You know, nobody should have to fight cancer alone. And so CSCLA is a great resource to provide support for both patients and caregivers. And I love what this slide says about community making everyone stronger, right? Cancer Support Community Los Angeles is a nonprofit whose mission is to ensure all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. These slides were reviewed and updated by pharmacist Sandra Coular in March 2024. And so for today, we will go over, we will provide an overview of breast cancer and what it is. We'll provide an understanding of the GI system and what side effects can occur. We'll provide some tips for coping with GI side effects and coping with the emotional impact of cancer. And then lastly, we'll provide some caregiver support and resources for patients and caregivers. So what is breast cancer? Breast cancer occurs when cells in the breast grow out of control. It can develop in one or both breasts. It is the most common cancer among women in the United States. Roughly about 12.9% of women will be diagnosed with breast cancer in their lifetime, except for skin cancers. And men and non-binary people can develop breast cancer as well. It's a little bit less common, about 1 in 1,000 men develop a breast cancer in their life, but it is possible. So to understand breast cancer and just treatment options, we need to understand the structure of the breast. And so breast is made up of lobules, which are glands in the body that help produce the breast milk. Nipples are the openings in the skin of the breast, surrounded by the areola. Ducts are small tubes that help carry breast milk from the lobules to the nipples. Stroma is fat connective tissues that help keep the ducts and lobules in place. And then we have lymph vessels, which are tubes that help carry blood and fluid away from the breast. And so the lobules and the ducts are two of the areas where breast cancer primarily develops. And so breast cancer is kind of sectioned in terms of where the cancer started. And so a lot of times you'll hear, there's non-invasive ductal carcinoma in situ or lobule carcinoma in situ. And so that delineates where it's located, and whether it's non-invasive, like the ones I just said, or invasive, which we will go over more in depth. Metastatic breast cancer, also known as advanced or stage 4 breast cancer, means that it has spread to other areas of the body. And so the subtypes of invasive breast cancer are estrogen receptor positive, progesterone receptor positive, HER2 positive, which stands for human epidermal growth factor receptor. It's a type of protein, and triple negative breast cancer. And triple negative breast cancer is one of the most invasive breast cancers, just because they don't have the estrogen or the progesterone receptors, or don't make any or enough of the HER2 protein. And so it spreads a lot quicker, and it's a lot harder to treat. So today we'll go over, breast cancer treatment side effects and any tips that will go along with it. So breast treatment side effect, a treatment-related side effect is any unintended condition that occurs as a result of cancer treatment. So a lot of patients do have side effects that aren't related to treatment, but these are specifically treatment-related. Different cancer treatments can have different side effects, and a lot of the times it's specific to where the cancer is located, like head and neck cancer. A lot of the times if they're receiving radiation, or if they have a mass, right? If there's a mass that's obstructing swallowing, etc., that can affect the throat and the mouth. A lot of the times it's just treatment related, right? And so everyone experiences cancer treatment and the side effects differently. Like I said, so it's, breast cancer can cause different side effects. This presentation will focus on GI side effects or gastrointestinal side effects. If you are experiencing any of these, please let your health care team know, so we can give you the care that you need. In order to understand the gastrointestinal system, let's review what it is made up of. And so it starts always in the mouth. And so we have enzymes called salivary amylase and linguinal lipase that are already digesting our food, even once it hits our mouth, travels down through the throat, goes into our stomach, passes through our small intestine, large intestine, and finally exits through the rectum and the anus. And so we'll review how to cope with these GI side effects today. Some common side effects that can occur starting from the mouth all the way down to the last part of the GI tract. So a lot of patients do get mouth and throat changes, whether that includes, taste alterations or sore mouth, nausea, vomiting, constipation, diarrhea, weight changes, and loss of appetite. Specifically for mouth and throat changes, like I said, taste can be altered. And a lot of times patients can report a metallic tasting, bitter tasting, food tasting too sweet, too bitter, too sour. It really just depends on the individual. Dry mouth is also called xerostomia. And so dry mouth can occur due to, maybe treatment related, but also if the patient is not drinking enough water or anything like that. Mouth sores or mucositis can occur, pain or swelling in the mouth or throat, sensitivity to hot or cold foods, difficulty or pain with swallowing. A lot of times this is called dysphagia, tooth decay, and oral thrush. It's also called candidiasis. That can occur, sometimes it can occur, when after chemotherapy or during chemotherapy, it puts your, the mouth system at risk for infection. And so a lot of times this can occur. So how do we cope with these? In terms of food and nutrition therapy, choosing foods that are easy to swallow is always the best option. You want to choose things that are maybe more creamy based if you need higher calorie options. So things like creamy soups or, potato soups, things like that. Softening hard or dry foods with gravy or sauces or other liquids can improve easier chew. And so this can include things like, crackers with rough edges or slices of bread or toast that are a little bit harder to chew. Dipping them in milk or dipping them in water or, dredging them in sauces or gravies can improve swallow and it can improve chewing. Avoiding foods that cause discomfort. And so, if the crackers, like crunchy crackers, spicy food, salty items, or sour foods that can irritate the mouth is not working, then it's generally better to avoid them. Avoiding alcohol and tobacco products. A lot of the times these do irritate the mouth and make mouth sores or mouth pain worse. Eating foods, something that's not on here that I also recommend patients is eating foods that are more at room temperature or colder as opposed to hot. That way it doesn't, it's not a shock to the mouth. There's other non-food related tips to cope with sore mouth and throat, and these include drinking through a straw to avoid sore spots, sucking on ice chips. When you have mouth pain, a lot of the times the coldness actually helps soothe the mouth, and using a baking soda rinse before and after meals. A lot of my patients have found this helpful. A lot of them also use magic mouthwash prescribed by their oncologist, and so both are great options. In terms of mouth and throat changes, so things to do to cope with dry mouth, drinking definitely plenty of liquids and keeping water on hand. A lot of the times I recommend patients just keeping a water bottle near them at all times. And even though they're not drinking all of it in one sitting, but just taking sips throughout the day. Adding lemon or water or lime to water if acidic foods do not irritate you. If they do, I recommend avoiding them and just adding something maybe sweet to the water. and that way it can help promote hydration. Drinking fluids often to keep the mouth wet, and moistening foods with sauces and gravies. A lot of the time that coats the food or it coats the mouth, which can prevent the dry mouth. Some non-food tips to cope with dry mouth include using lip balm or petroleum jelly to protect your lips, sleeping with a humidifier or a diffuser in your room to help moisten your mouth at night, and using alcohol-free mouthwashes and or saliva substitutes. Alcohol-free products are definitely important, especially the mouthwashes, since a lot of patients use that daily. On to the next, nausea and vomiting. Nausea and vomiting is a common symptom with breast cancer treatment, and so nausea basically is a sick feeling in your stomach. Vomiting, also called throwing up or puking. Some food tips to cope include having smaller, more frequent meals. It's okay if you can't eat them every 1 to 2 hours, at least, I would recommend at least every 3 hours. And having smaller, more frequent meals, that way it's not a shock to your stomach. It's easier to have smaller meals. Sucking on ice chips or popsicles. I would recommend popsicles, and that way you get a little bit more hydration, but also more calories. Drinking hydrating fluid. So this does include water, but also juices, chamomile, ginger tea. Other ones I recommend are coconut water and aloe vera juice. If you are vomiting, you are also losing electrolytes, and so it's important to replenish those electrolytes with drinks that have potassium naturally, such as coconut water and aloe vera juice, and sodium. And so sometimes drinking carbonated beverages that have lost their fizz or gone flat can be helpful. Sometimes the carbonation can, if you are also having mouth sores at the same time, it can irritate the sores, and so it's kind of depending, on the patient. Eating bland foods is definitely important during, during nausea and vomiting. Your body does not, sometimes, a lot of the times your body doesn't even want food, so having bland foods is kind of where to start. Things like toast, crackers, gelatin, rice, pasta, things like that are your safest bet. Protein foods are generally well tolerated as well. So things like low fat, lean protein options, skinless chicken, fish if it's not too strong smelling, or eggs as well if it's not too strong smelling. You want to avoid spicy or fried foods or those that have strong aromas. So if you're not able to tolerate fish or eggs, garlic, onion, things like that, then definitely don't have them. Something I also recommend patients is not really being in the room, in the kitchen when someone's cooking, because a lot of the times it's very strong smelling and it can promote that nausea. Some non-food tips include acupuncture and acupressure. You can also discuss taking antiemetics or anti-nausea medications with your care team. Trying breathing exercises, meditation, guided imagery to help settle your stomach and your mind. A lot of times rinsing your mouth in between meals can also help. That way it gets rid of that food taste. And also lying seated up instead of lying down. That way it prevents the food from coming up that quickly. The next one we'll talk about is constipation. And so constipation includes difficulty having a bowel movement. This can happen a lot of the times difficulty is a little vague. So I like to tell patients, if it's been more than 2 days or 2 to 3 days without a bowel movement, or if you are straining, even if you're going daily, but you're straining, that could indicate constipation. And like I said, a lot of things can cause constipation, surgery, from the anesthesia, inactivity. A lot of the times cancer treatment can cause fatigue, and it can prevent you from including your regular activity, which is helpful for bowel movements. And so that sometimes, and dehydration. Pain medications and some other cancer drugs can also cause constipation. So some nutrition therapy to help with this constipation includes eating more foods that promote bowel movement. So these will include things like fibrous foods, right? Whole grains, fruits, vegetables, beans, nuts. A lot of the times dried fruits are also easier to eat. Dates, apricots, plums, or prunes can be a good snack to promote a bowel movement. As you're increasing your fiber, you also need enough fluid in order to combat that, or else you'll get more constipated. So making sure you're drinking at least, usually the standard is 64 fluid ounces, which is about 8-ounce cups. That could always go up. And be more if you are, if your needs are a little bit higher. But at least 64 fluid ounces is your goal. Drinking warm liquids and fruit juices can also help. Warm liquids tend to stimulate the bowels and, promote calmness. Talking to your doctor about the foods that have fiber. So just like we discussed. Foods to avoid, if there's not a lot of foods to avoid if you are constipated, a lot of the times people are very individualized in the foods that cause constipation. So sometimes cheese, sometimes, protein, or sometimes grain, like simple grains, right? That don't have any fiber. So it's very individual for what to avoid. Talking to your doctor about taking a probiotic supplement can help, or just as a dietitian, you'll hear eating foods with probiotics. So things like yogurt, kefir, sauerkraut, things like that. Limiting gassy foods and gassy vegetables, things like broccoli, corn. If garlic causes a lot of gas, or onion causes a lot of gas, definitely those two, that definitely avoid them. And then always talk to your healthcare provider before using any supplements, laxatives, or stool softeners, and before making any changes to diet and exercise routines. Having your doctor be on the same page as you is always helpful. Some non-food tips include exercise. I like to tell patients bowel movements and the digestive system works based off of 3 F's. So fiber, fluid, and fitness. And so during cancer treatment, you probably don't have a lot of energy. So gentle exercises like yoga, walking, and stretching can be helpful. If you do have a lot, more energy, you're not feeling that much fatigue, you can include more resistant exercises for also to maintain muscle. But if not, then, light, slow, and steady is also helpful. You can also talk to your healthcare team about drugs or other tips that can help with constipation. They can prescribe stool softeners or laxative as needed. If you have cramping that lasts for more than 2 days, or you have not had a bowel movement, definitely message your oncologist or your healthcare team immediately, because this can be a sign of a bowel obstruction and it can be serious. Diarrhea is another type of treatment side effect, and this includes frequent loose or watery bowel movements. Things that can cause diarrhea are infections, chemotherapy, surgery, radiation, and sometimes other things as well. In terms of coping with diarrhea, if you have had more than 3 episodes of diarrhea in a day, definitely call or message your healthcare provider. Before taking any anti-diarrheal drugs like Pepto-Bismol or Imodium, or before making any changes to your diet or exercise routine, consult your healthcare team. Some things to help with diarrhea is definitely drinking the recommended amount of fluid as able, and eating smaller meals that are lower in fiber. A lot of the times, low fiber and primarily soluble fiber, which helps bulk up the stool. Things like bananas, oatmeal or cream of wheat, cooked carrots, applesauce, things like that, which are also known as brat diet, are the most helpful. So like I said, definitely meeting your fluid needs is important. A lot of the times I always recommend drinking fluids with electrolytes. So things like coconut water, like I said, aloe vera juice, broth. Fun tip, bone broth is very trendy right now, but it actually has a lot higher protein. And so even if you're not able to eat, regular food, a simple chicken broth or chicken stock won't give you as much protein, but if you're able to hold down bone broth, you can get close to 10 grams of protein for 1 cup. Diluted fruit juices is often better tolerated than straight fruit juices. So that's also an option. If you don't have these available to you, sometimes using the electrolyte powders can help. Things like LMNT, liquid IV, things like that. Baked chicken, turkey, or fish, things that are very easy to tolerate, low fat, are going to be your best friends when you have diarrhea. Canned fruit in the juice, I recommend taking out the juice just because it's very sweet. But canned fruits generally are lower fiber since they're a little bit more processed. If you prefer not to do canned fruits, you can always do, like I said before, bananas or applesauce, or mashed up cooked pears, things like that. Oatmeal, cream of wheat, cream of rice, things like that is something that I recommend just because they're low fiber. Oatmeal is a little bit higher fiber. It does have more soluble fiber though, so it helps bulk up your stool. Plain potatoes without the skin is fine. You could see how you tolerate sweet potatoes, but definitely do half of one and then take off the skin. Drinks to avoid or other foods to avoid are going to be caffeinated drinks. A lot of the times caffeine stimulates the bowels. Same thing with hot drinks, and cold and alcoholic beverages just do not sit well when you have diarrhea. They can irritate the GI tract. Same goes for greasy and fried foods. A lot of the times greasy, fried foods, things with a lot of concentrated sweets or added sugar can just promote more diarrhea. Dairy foods, especially if you're lactose intolerant, is something that I don't recommend. I do, however, recommend trying yogurt or kefir just because of that added probiotic benefit. A lot of the times they also sell lactose-free yogurts, which is helpful. High fiber and bulky foods are definitely not something you want to prioritize during diarrhea. So avoiding raw vegetables, nuts, beans, whole grains, all good things, but just not going to help the diarrhea right now. So cooked vegetables, things like cooked carrots, or you could do potato and squash soups. You could do things like that that are generally lower fiber, easy to tolerate. Peanut butter is okay in small quantities, just not whole nuts. And in terms of fruit, like we said, bananas and applesauce. The next topic we'll discuss is weight changes. And so weight changes can be common before, during, or after treatment. And they can be attributed to medications, surgeries, physical activity or inactivity, and sometimes emotional state, right? Having cancer or caring for someone with cancer is a lot emotionally. And so sometimes that can also affect, you know, the way that we eat and how our weight changes. So the best thing you can do to lose, gain, or maintain weight is regular physical activity. The good thing is that cleaning and gardening also count as activity, so they can be part of your regular day and maybe a stress relief or a stress manager in your life, but also activity. It doesn't have to be much. You can aim for 15 to 30 minutes. For something to count as moderate intensity activity, it does have to be raising your heart rhythm or causing you to breathe a little bit harder. But even if especially during treatment, even if it's just taking a light walk, it's better than nothing, I like to tell patients. Finding a friend or family member to be active with is always helpful because it can improve accountability, and you know, it's always better and more fun to have someone with you. Ask your cancer center about physical therapy programs. You can also ask your oncologist to see if you qualify or if you can be referred. Usually they approve once or twice a week if warranted. And then before making any changes to your physical activity, definitely let your healthcare team know. And that way they're on the same page. Some benefits to physical activity include decreasing nausea. If you do have nausea, definitely start slow and steady. And it might just be brief, right? 10 minutes or 5 minutes at a time. And when you feel the best, that's when I recommend doing the exercise. Exercise a lot of the times can improve your energy. And so, you know, there's a big fatigue is one of the most common side effects for cancer treatment. And so a lot of patients tend to decrease their activity, right? Because they don't have that energy. But even just doing 10 minutes at a time or 5 minutes at a time when you do feel good can help increase that energy and maintain the muscle mass. Exercise can also help with improving sleep. Like in terms of insomnia, in terms of trouble sleeping or anything like that, it's a great way to promote better sleep as well. And it can help improve your mood. So I like to tell patients, all of my patients, that activity is not just physical, it's also mental. You know, if you're feeling sad or anxious or even depressed, you know, it can help improve your mood. And another one that's not on here, but it also is important, especially during specifically breast cancer treatment, is exercise can help prevent bone loss, right? A lot of the times, if we're not using our muscles, if we're not being active, we tend to lose that muscle mass, but also that bone mass. And so if you are doing a treatment for breast cancer that especially that is a aromatase inhibitor like anastrozole, that can actually promote bone loss. And so having regular physical activity can combat that. And so in terms of weight changes, if you are looking to manage weight gain, A lot of the times this can happen if you're fatigued and you're not exercising that much, or transitioning to menopause, or you have a higher energy intake during your treatments. We recommend choosing low-calorie options, low-calorie fruits, non-starchy vegetables, high-fiber whole grains, unless you're having diarrhea, in order to help fill you up, and promote portion control. Choosing low sugar, non-caloric beverages like water, seltzers, and plain tea is also an option. I recommend a lot of the times flavoring them with like fruit. So fruit infused water, adding a squeeze of lemon, adding a small pour of fruit juice. All of those can help you just maintain adequate hydration. Choosing baked and broiled lean meats like skinless chicken, fish, turkey, things like that, over high-fat meats like beef and pork. The good news is that they're also, lean red meat options, and so choosing like extra lean or lean ground beef maybe once a week can help replenish those iron stores. But of course, we don't want that very frequently. Avoiding sugar-sweetened beverages, like we said, pastries, baked goods, processed foods, including processed meats or processed items like chips, cookies, things like that, that offer very little nutritional benefit. And avoiding high-calorie foods like creamy sauces, cheeses, oils, fried foods, things like that. A lot of the times the fats are the highest, they have the highest calorie composition out of carbs and proteins. And so even if you're eating a small amount of these things, it can just really pack on the calories. Foods to manage weight loss. So if you're experiencing weight loss, you kind of want to do the opposite, right? So adding higher calorie foods into your diet. A lot of the times we recommend doing healthy fats, right? So things like avocados, olive oils, nut butters, a lot of the times you can also change your products to full fat options, right? To just provide a little bit more calories, depending on your needs. Protein is also important to help maintain muscle loss, and prevent muscle depletion. And so things like your skinless chicken, your fish, your nut butters, beans, eggs, Greek yogurt, cottage cheese, all of those things are packed with protein. Eating 5 to 6 small meals instead of 3 large meals a day can also help manage appetite and just help you practice portion control. A lot of the times you can also fit a lot more food in those 4 to 6 small meals, and you can make those 4 to 6 small meals higher calorie, right? So one of those options might be a smoothie, right? A high calorie smoothie, or a protein food like eggs with some sort of carbohydrate, and a fat like a toast with avocado, right? And then adding high calorie smoothies or nutritional drinks into the routine. And so this includes things like, and it can be Ensure, it can be homemade protein shakes, it can be a variety of different things. And so the Frankly Speaking About Cancer, the FSAC, has Eating Well resources to cope with these GI side effects. They provide a food journal and symptom tracker and handouts that can be helpful during your treatment, so definitely check them out. Cancer support community can also, it also has a recipe gallery. I don't know why that was so hard to say. They have a great recipe gallery that includes a lot of different recipes specific for breakfast or any sort of option. Here are a couple of examples. And so if you're having mouth and throat changes, you can choose this apple cinnamon muffin that maybe is a little bit sweeter to combat that bitter taste. If you're having nausea and vomiting, choosing golden milk popsicles. They have turmeric, which helps inflammation as well. And if you're having diarrhea, you can choose more of a turkey and barley vegetable soup that's cooked. So the vegetables are cooked down, easier to digest. In terms of supportive services, definitely nutrition counseling is definitely important. And so a registered dietitian like one of us can help just manage your symptoms in terms, and then provide medical nutrition therapy if you're having one or all of these side effects. An RD who has the letter CSO after the name is a board certified specialist in oncology nutrition. And so they are definitely great resources. I don't have mine yet, my certification yet, but I'm hoping to get mine next year. And then meeting with your oncology dietitian on a regular basis can just help provide support, but also help provide accountability, to and provide ideas for you to add or change up your nutrition routine. Rehabilitation services are also important. Things like physical therapy, occupational therapy, speech therapy, especially if you are having issues swallowing. Physical therapy, if you notice some fatigue or more weakness, is definitely important. Palliative care is important to basically the palliative care team improves the quality of life for both the patient, patients and family or caregivers. And so it's not hospice. A lot of the times, there's an association with hospice, but it's more focusing on symptom relief, pain relief, stress relief, things like that. It is appropriate at any age and at any point and can be provided at the same time as treatment. In terms of the emotional impacts of cancer, this can include distress, and so can impact your cognitive, behavior, social, emotional, and spiritual functioning. If you're experiencing any of the symptoms on the right-hand side, lack of sleep or appetite changes, suppressed mood, suicidal thoughts especially, then definitely talk to a healthcare team to get help. Emotional expression can help your physical and mental health, and so we always want to promote expressing emotions. It helps you be in control of your emotions. It helps promote self-confidence, and a lot of the times repressing the emotions can just lead to emotions building up. I think we've all experienced this, where emotions just build up and we get aggressive or hostile or alienate ourselves, or just kind of give up, and we're things like basic tasks seem like very hard for us. Reaching out is definitely important, and so talking to a trusted family or friends, finding a support group. I think that's great. One great thing about cancer support community is that they have a lot of support groups and online resources for patients and caregivers. Talking to trained mental health professionals, whether it's in your care team at the hospital or an independent option, and finding mind and body programs for stress relief. Support for caregivers, caring for someone with cancer does take a toll on you, and a lot of the times because you're pouring out, and so supporting your loved one is important, but also helping you support yourself or helping support your caregivers. It can help, one thing I will say, help fill your cup so you can help fill others, right? So remember to self-care, talk to others for support. A good resource is mylifeline.org. to help with scheduling and all of that. And then communicating with the healthcare team. And so for looking ahead, you know, we talk about hope. It can be a powerful coping strategy that empowers people to look beyond the moment and into the future. And just going back to the community is stronger than cancer. So as a community, we work better. Here are some specific breast cancer resources. If you can't get all of them right now, write down, if you can't write down all of them or take a picture right now, we will have them at the end of this slide. We are Providence St. John's, and so it's also Providence is also a great resource just for care team, but also we have dietitians, we have physical therapists, we have speech therapists that are available. Just some information about the helpline and my lifeline that we discussed earlier. Cancer Support Community has an experience registry, which is an online research study that you can, it's just like a 30-minute survey that caregivers or patients can do to help improve care. It's used to enhance cancer care, improve support services, influence healthcare policies, and much more. Also joining you know, policies and becoming an advocate to have your voice heard. And that concludes the presentation. Thank you so much for participating, and thank you so much for attending. In the time that we have, we can get through a few questions.
Thank you, Ashley, for your meaningful presentation. I know we all learned a lot. We did receive a few questions in the Q&A chat, but if anybody else has any other questions, please feel free to type them in the Q&A chat right now. So I will go ahead and get started with these. Someone asks, what are your thoughts on wheat dextrin and psyllium?
I assume this question is primarily for fiber and helping manage bowel movements. Psyllium is more of that soluble fiber, and so a lot of the times psyllium husk can help improve bowel movements and bulk up stool. And so if you know, wheat dextrin, I haven't worked with too much, but the psyllium has helped patients. And then I see another one saying, how do you counter weight gain and slow metabolism from aromatase inhibitors? A lot of the times it's not really slow metabolism. It might be with weight gain, it might be like things that we mentioned. So maybe having a higher caloric intake coupled with lower activity during cancer treatment. It could be, you know, low mood, things like that. And so I do recommend watching portions, sizes, choosing leaner options, like we discussed in the presentation, leaner protein options, limiting your portions of fat, like fats. So if you want to discuss more that in more detail, we can discuss that. And then also staying active. So, you know, even if it's a 10 to 15-minute walk, that can help improve metabolism, right? Because the more muscle you have, the more metabolically active you are in burning calories and things like that. So definitely staying active is important, eating enough protein, lean proteins, and reducing just watching, not really reducing, but just watching your portions of those high fat food options.
Great, thank you. And we also just received another question. Someone said that they are prescribed Pepcid that they need to take on a daily basis for 5 months during chemo. and they want to know what the effects of that on their stomach is for normal flora for long term.
So that's a better, I would say that's a better question for your doctor. Pepsid is it's an anti-acid, right? And so in terms of, I would say if you have a concern that it's affecting your gut flora, then that's where like your probiotics, adding a variety of fruits and vegetables into your diet would come in. Maybe going forward, you make sure to include at least 1 or 2 probiotic foods in your day. So things like yogurt for breakfast, and then or kefir for breakfast, and then maybe sauerkraut with your lunch, miso, things like that. But if you want a little bit more detailed answer, I would recommend asking your GI doctor about that.
Great, thank you. And people can feel free to continue putting questions into the Q&A, but we also did receive some at registration, so I'll go ahead and go to those. Someone asked, can I expect to see improvement in my gastrointestinal symptoms caused by breast cancer treatment even 4+ years later?
Yes, I would say I kind of need a little bit more information, right? Whether the patient is still undergoing treatment, if it's been 4 years since treatment, and there's been maybe radiation damage or anything like that, then maybe it's just about modifying the foods that you're eating, making sure you're staying hydrated. If it's more on the constipation side, then adding more fiber. So I would love if, I don't know if that person is in the chat right now, but I would love just maybe providing a little bit more detail, maybe specific symptoms and whether you're still undergoing cancer treatment or not.
Great, thank you. And please feel free to type in anything into the Q&A chat. So we got another question asking, how can one deal with a slow metabolism after treatment?
Again, I don't really think it's a slow metabolism. It might just be that the patient or that individual has started to, exercise less, maybe eating higher caloric intake than their norm. Maybe they lost some muscle mass, and with that, maybe lost a little bit of their ability to metabolize those calories. So I don't really necessarily say it's a slow metabolism. It's more just changes from your previous diet or previous activity. So again, to answer, I would say definitely including regular activity. Even in my own life, I like to include at least 30 minutes of something that's raising my heart rhythm. So activity is important, staying hydrated to prevent the dehydration, and watching, it's more encompassing, but watching portion sizes, making sure you're eating enough protein if you are doing activity to help build and maintain that muscle mass.
Great, thank you. And then I think we have time for one more question. So we did get asked during registration, how can one best deal with the lasting GI effects of treatment?
And I would say, again, like modifying dietary habits. And so there's not too much detail in that question, but I would say, if you're having diarrhea, then modifying your diet towards more lower fiber, more soluble fiber foods. If you're on the side of, constipation, then including more fiber and staying hydrated. If you are, I would hope nobody's having nausea, that far out into treatment, but if you're still having nausea, then, choosing more of those bland, maybe trying ginger chews, ginger tea, things like that. staying hydrated, replenishing those electrolytes, things like that. So again, it's just, it would help to have more detail.
Great, thank you so much. And I believe those are all the questions we have received. I want to thank you again, Ashley, for your meaningful presentation. I know we all learned a lot and really appreciate you sharing your knowledge. We do have one closing slide just to give people a little bit more information. Kathy, if you can go ahead and share those slides, please. Okay, perfect. So if you all would like to learn more about Cancer Support Community Los Angeles and the different programs we offer, you can go ahead and visit our website at cancersupportla.org. And if you have any questions, please feel free to email us at info@cancersupportla.org. Ashley has also very kindly accepted to share her presentation slides with us. So if you would like a copy of those, please feel free to email us. We would also like to highlight our breast cancer support group. This one meets on Mondays from 6 p.m. to 8 p.m. So if anyone is interested, they can go ahead and scan that QR code. Or if you would just like more information, please feel free to email us or call us. The number is on that flyer. And just a reminder, we will be sending out, you will be receiving a survey right after this webinar ends. We would really appreciate it if you all could fill it out. It gives us a lot of feedback that we can use in the future. You will see that survey once you log off of the Zoom meeting, and you will also receive the survey tomorrow. If you have any questions about the survey and how to fill it out, please feel free to email or call us. We're more than happy to help you out. And yeah, I believe that's it. Ashley, I want to thank you once again. We really appreciate having you here, and it's always a pleasure. And thank you everyone for joining and for your participation, and we hope to see you at the next one. Thank you. Bye.
Thank you for having me.